And in health news this morning, October is Breast Cancer Awareness Month, and while most people are aware of breast cancer, early detection is key. Here with us this morning from Spectrum Health Medical Group is Dr. Paul Wright and Kelsey Haynes. Good morning. Thank you so much for being here with us. And as we mentioned there in the introduction, early detection is the key. So let's talk about prevention and early detection and how those two things kind of tied together, especially when it comes to those self-exams.
So we've put a lot of emphasis lately on breast awareness, and that's to say just for women to know what's normal for them. And if they detect something that's new or abnormal feeling, to just let their doctor know. That could be finding a new lump, changes in the skin, or changes in the contour of the breast. And that's a time to get in touch with your doctor and find out what the next step should be.
That's right.
By far and away, still the most important screening test for breast cancer are mammograms. Those help with early detection before you can feel any changes in the breast. At Spectrum Health with Betty Ford Breast Care Services, we have 14 locations throughout West Michigan where women can receive their mammograms. There are also 2 mobile mammography units. And so now with that access, it's easier and more convenient than ever for women to have access to mammograms.
Is it still about the age of 40 for a mammogram? Is that what they're still saying?
The recommended age for most women will be age 40, but you should talk with your doctor about the risks and benefits of when to start screening, and that can be based on your family history and other factors.
Any other stats we need to throw out there, especially when it comes to early detection and maybe survival versus?
Yeah, so right now we have over 3 million women in the U.S. that are survivors from breast cancer. And a lot of that can be attributed to early detection. We know from recent data that the survival rate for early detected breast cancer can be as high as 99%. And so it puts a lot of emphasis on that and continues to give reason for women to get those mammograms yearly.
That's right. Well, we always refer back to Betty Ford, and of course she was very open and public about what she went through. So how does this kind of go into your Candid Conversations that Spectrum holds?
Yeah, so absolutely. So Betty was one of the first women out there to actually say, she's in the limelight going, I have breast cancer. As the First Lady, her openness, her candor brought to the American people and women to speak about their health issues and concerns and engage in their breast health. Ultimately, we want to continue that legacy and have Candid Conversations. Yeah,
and right there's a look on the screen about the upcoming Candid Conversation. What makes this one so different and special? So we've really listened to the community. This is the 5th year of Candid Conversations, and every year we ask people, what do you want to see? And so we're going to actually include health exits both internally and externally. We're going to talk about health disparities, risk, survivorship, cancer genetics, and we're going to have an increased number of health booths at this year's event, so both Spectrum Health specialties as well as external vendors coming in and talking about their services. Yeah, so basically come with all the questions that you might have. There's no greater access to someone and all the experts rather than coming to one of these Candid Conversations, right? Absolutely. Is it something they need to pre-register for? Yes, absolutely. Okay. So on our website at spectrumhealth.org/Betty-Ford-event, it's a mouthful, but they can go on there and register. It is a free event, so we definitely are encouraging the public to come, bring a friend, bring a family member, and come learn a little bit more, and I'll have a fun time at the same time. That's right. And let's go back a little bit to the mobile mammography units that you have. Of course, this is a great way to make sure that anybody in the community has access to a mammogram. Is there any other way that the community can help keep this out on the road or help in this situation?
Yeah, so I think these are ways in which we can just get more access to mammography for women. They are also equipped with a special type of mammography called tomosynthesis. And that's a 3D mammogram that can be used and is particularly helpful for women that have dense breasts. In addition to those, Betty Ford Breast Care Services has a wide variety of diagnostic imaging available, like breast ultrasound and breast MRI, that can be used if there's any abnormalities detected on mammogram. Wonderful. So once again, let's throw the information on the screen for everybody at home in regards to the upcoming event, Candid Conversations, and many people that can come should come and get access to all the healthcare experts out there, right? Yes, absolutely, and have a good educational and fun time at the same time. That's right. And when it comes down to insurance, of course, if you have any questions, whether if you're underinsured, don't have insurance, this is a great way to find out more information about that too, how you guys can help.
Absolutely. We want to make sure that everyone has access to a mammogram, so we've started a fund at our foundation, and so people can actually donate dollars there in the community to make sure that everybody has access to mammograms.
Wonderful. All right, thanks for the great information.
Thank you.
All right, well, if you've been diagnosed with cancer and would like a second opinion or a consultation, please call 855-SH-CANCER. That's 855-742-2623.